Honorable African Ministers of Health, dear brothers and sisters, it's my privilege to invite all of you to attend the third convening of the Ministerial Executive Leadership Program, MELP, which will take place on February 13, 2024 in Addis Ababa, on the margins of the African Union Summit. This current MELP is under the theme Harnessing Political Commitment for an Adaptive and Resilient Health System. This important forum offers all of us the unique opportunity to shape the future of health security and prosperity in Africa. Today, we stand at a crossroads in the history of our continent's health journey. Africa's progress in public health has been marked by remarkable resilience and determination. Yet, our achievements coexist with daunting challenges. Our systems have been tested by a dual burden: the long-standing struggle against infectious diseases such as malaria, TB, HIV, and neglected tropical diseases, alongside the rising tide of non-communicable conditions like high blood pressure, diabetes, and cancer. These issues are compounded by rapid urbanization, shifting lifestyles, and the complex implications of climate change. Africa is facing an unprecedented convergence of crises that threaten to reverse decades of progress in public health in Africa, that could push morbidity and mortality rates back to the levels last seen in the early 2000s. The number of health emergencies in Africa surged from 153 outbreaks in 2022 to 242 in 2024, significantly increasing the risk of another pandemic emerging from the continent. Ministers, our task is not only to address these challenges, but to build health systems that are resilient, self-reliant, and forward-thinking. Systems that can secure the health of our people today while paving the way for a prosperous future for the continent. The recent past has shown us that no country is safe to health threat if all of us we are not. We have witnessed outbreaks of mpox, Ebola, cholera, and marburg. These outbreaks expose vulnerabilities of our collective preparedness. Each outbreak, each of them, is a stark reminder that while progress is possible, it is fragile. Our health systems must be able to absorb shocks, to adapt to new challenges, and to emerge stronger. This reality demands that we innovate, not just in our approaches to healthcare delivery, but also in the very structures of financing and resource allocation that underpin our systems. At the heart of these challenges lies a rapidly shifting global health financing landscape. We have also seen policy changes that have intensified our challenges in Africa. We know, as we posted in our WhatsApp group, that wealthy nations increasingly focusing on their own domestic issues are pulling back from the robust support that has long underpinned our public health initiatives. Let me give you some examples. As we know, the US decided to withdraw from WHO, and there was this 90-day pause on foreign assistance, and Africa CDC supported for the waiver, as you saw in our WhatsApp group. The European Union proposed a €2 billion cut over the next 2 years. Netherlands is planning to cut its aid budget by €8 billion over the next 8 years. And Germany announced a cut of €2 billion to aid, while Finland, Sweden, and Switzerland, they are announcing significant cuts, even stopping funding to some countries, organizations, and programs. In addition to that, as you know, some of your countries are on course to transition out of key global health financing mechanisms, such as Global Fund, Gavi, and the World Bank International Development Association by 2040. This reduction in foreign aid is already beginning to impact on the availability and quality of essential healthcare systems, particularly for our most vulnerable communities. The potential consequences are huge. Without swift and decisive intervention, Africa CDC is projecting to have around additional 2 to 4 million preventable deaths each year from disease that we already have the knowledge and tools to combat. The human cost is also huge, and the economic repercussions are equally severe, with estimates suggesting that billions of dollars will be lost in productivity. And that will push up to 39 million Africans into poverty and making our economies and political system unstable. Building on these experiences, we have learned critical lessons: the importance of timely data sharing, of building community trust, of investing in resilient health systems. These lessons have also made it clear that our approach to health security must evolve, not just here in Africa, but globally. To address these challenges and chart a stronger path forward, we are guided by the principles of the African Public Health Order, under the 5 pillars that we know, regarding strengthening public health institutions, regarding building strong capacity and skilled health workforce, regarding expanding local manufacturing for vaccines, diagnostics, and therapeutics, and also increasing domestic financing to ensure health sovereignty. We are also thinking about how to enhance regional collaboration, and that's what we call the respectful partnership we are promoting. These pillars not only reflect our aspirations, but also equip us to act decisively and collaboratively in the face of health challenges. Strong, transformative leadership is essential. This is why we created the Ministerial Executive Leadership Program. It is designed to support our health ministers to operationalize these pillars in your respective countries. MELP provides the tool, the networks, and the strategy that are necessary to strengthen our health systems in Africa, to secure sustainable financing, and to foster regional collaboration that will amplify our collective impact. Through MELP, we aim to build the leadership capacity that is needed to turn lessons learned into actions that will drive the meaningful change across the continent. Honorable Ministers, I urge all of you to join us on February in Addis Ababa, on the margins of the AU Assembly on the 13th and the 14th February, together we'll reflect on the lessons of the past, align our priorities, and strengthen the partnerships and collaboration necessary to transform Africa's health systems. Your leadership is essential in advancing the vision of health sovereignty and equip our countries with the sense of equity for all Africans. Let us seize this moment to reaffirm our commitment to protecting and uplifting the health of our continent. I look forward to welcoming all of you to Addis and working alongside you to achieve our common goal for our continent. Thank you.